vaccines or some other medical problem that you're seeking. So I would say those sort of are the sphere of trust that I would encourage people to seek.
Thank you, Dr. Muhammad. Dr. Hudson, any other sources that come to your mind that you're like, you know what, if folks really want to get some really trusted information and be able to discern for themselves, where else should they look?
Ones that I would have actually picked, but in addition to those, the other areas are looking at either the folks and or the groups. So I know in our studies, a lot of people talked about social media. Now, social media there are some places like the CDC that have social media, and that is a trusted source. There are other places where they're sort of spreading rumors and doing things that are not verified by anybody. And so what you really want to do is to be able to look at who are the folks, where are they getting their information from? And if they're getting their information from the state, from the CDC, and from others, then that's probably a good source. If you can't trace that original source back to an organization, then that is likely not one that you really want to hold a lot of trust in. The other area that I would also add is, you asked me to begin with about the faith-based community. So there are a number of churches that have health ministries where they have nurses and other health workers who are part of those groups. And so that is yet another place that we can go within our communities to be able to get information.
Dr. Hudson, you touched on the gift and the curse that is social media. And I think you're absolutely right. And I think the piece that you said that I want to amplify, and I encourage everyone who's listening to what Dr. Hudson said is critically important. Take the time to source back where the information is from, right? If it's coming from, Joe Blow Healthcare Inc., you probably need to take a pause on whether or not you can run around, go to the barbershops or beauty salons and tell everyone what you found out. But if it's traced back to somewhere where it's public sourced, like a health department, a state health department, local health department, like the CDC, or I think you're in a better position to take that information and move it forward. Dr. Silvera, same question, but a little bit of a twist, if you don't mind. You've done this, you've seen it, you've talked to so many folks around this space. Take a second, if you can, to give an example of the misinformation that you have heard and be able to just get a minute to debunk that in front of this audience here. Because I've heard, and I have the privilege of getting information as an elected official from our state and others. And I go and talk to folks, and folks will tell me, no, Troy, this vaccine will make you blind, just as an example. And I'm like, because I heard it on the internet. But like, what are some of the things that you've heard that are just so just outlandish? But how do we then sort of walk that back to get the trust that we need in the vaccine?
That's a great question. And I could probably sit here all day listing all of the misinformation. I think one of the things that I've heard, especially being on a college campus when we required the vaccine for our students, were concerns about fertility. Right, so that this was going to make our young people infertile, and worse, the disinformation piece was that somehow was purposeful, right? So there's the concern about this is a new vaccine, and then there are people who are actively working against the vaccine and creating disinformation to scare people. The pushback that I always give is that there has been no vaccine in the history of vaccines, this one included, that have caused fertility issues. Yes, it's a newer vaccine compared to some that have been out there, but the data, right, again, going back to that source, going back to the original research, has all shown that these are not only safe and effective, but incredibly beneficial, particularly when we're looking at pregnant women who have a higher risk of severe illness and mortality. And then it provides a measure of protection to those infants who otherwise have no immunity, right? And so if we take some of that information and really break it down, and again, take the time to listen and then respond with data, I think that that's really going to be very important. Another one that I've seen broken down, and again, as you said, the sort of double-edged sword of social media, well, these vaccines are going to change your DNA. There have been some really outstanding immunologists, virologists, and epidemiologists on TikTok, for example, explaining why that is not true, how the vaccines work. And I think for me, part of what comes into the conversation is the need for more people who are trained in health education and health communication to translate the information, right? We are getting COVID is rapidly evolving. It is new. The vaccines are coming out. We're now having them for children under 5. And what we need are people who are very skilled and trained specifically to translate what I call, the science sort of nerd language to everyday people, right? And really think about it. And this is the way I tend to think about it. Most people have not had the privilege of getting a PhD in their field or in a field. And so it's my job, because I've had that, to try to use that to make sure that everybody has the same access to information and good, solid, sound information that I have. And so I think we also need to invest in that a little bit more, and make sure that we have those community health workers who can go out and start to debunk that information in a way that is trusted and accessible.
Thank you, Doctor. And Ms. Forrester, just to pick up on that. So from the state's perspective, you run an incredible office of minority and multicultural health, and trying to get the right ambassadors out there to talk about this and talk about it in such a way that we dispel some of the things that Dr. Severo sort of walked through. Folks, give us a little flavor on what your office is doing to actually do that, because you have a broad swath of things you're doing, looking at trying to incorporate health equity into more policies, but how are you actually implementing that?
Yeah, thank you for that. So just to give some background information, right now there's about 10 municipalities here in New Jersey that need some resources for the vaccine. And it's basically what our panelists have said. It's like, how do we get that information and the vaccines to these specific municipalities? And the one thing that we did with my office is that we grant funded over 30 nonprofit organizations and faith-based organizations to be those messengers. So it's exactly what Dr. Hudson said. It's those trusted messengers are going to do the work. It's right now, it's not going to be what the Department of Health is asking you to do. It's going to be from those trusted sources. So before that, we even built community-based vaccine clinics, and it wasn't coming from the Department of Health. It was coming from those faith-based organizations. A year ago, actually, we built a very, very large one in Passaic County, and because of the pastor and his team, vaccinated over 5,000 people. Because they didn't have access to the vaccine. Now we're at a different time. A lot of people are tired of COVID, and they just they want it to go away. And part of that is the vaccine. So it's those trusted messengers. So by funding nonprofit organizations and faith-based organizations, we're building an ambassador team who are currently being educated and who give the feedback loop. So what they're hearing on the ground comes back to us on a weekly basis, and we turnkey a very quick education materials. Basically, what Dr. Novato had said is focus on health literacy, making it very simple, very digestible, and something quick. So you have literally 2 minutes of reading material that you could digest and then comprehend. Another piece that we're noticing out in the field, that we're out and about with our community health workers, because we have over 20 community health workers, a lot of it is now that personal communication with a family member who was vaccinated, or a friend, a close friend. That's going to be more influential than a media campaign or a billboard. So we are looking really closely at what strategies are working, and we're pivoting very quickly on a week-to-week basis. It's constantly growing, it's constantly evolving, but I think we have amazing partners. We have the research teams here, from Rutgers and other universities that are really informing us as well.
Awesome. Thank you, Ms. Forrester. So, and Dr. Muhammad, I want to ask you this question, because we've talked a lot about vaccine hesitancy. We walked that through, but I guess the fundamental question that we probably should have started with, so I'm a poor moderator, but we probably should have started with is just the basic question of the safety and effectiveness of the vaccine, right? We hear so much about it. And I want, if you can just take a second or two to talk about not just the safety and effectiveness of the vaccine, which has been called into question now since it started being produced and moved about, but can you give a little talk on the scientific rigor of vaccine research and vaccine clinical trials, and what are the constructs of vaccine clinical research that can give us all the confidence we need in the FDA authorizations, because we knew it was done originally under like an emergency authorization. So for some people that meant that, whoa, it's not tested as much as it should have been. But if you could take a second or two to really walk us through what goes in to vaccine research, the clinical trials, and ultimately the authorization for it to move forward.
Yeah, this is such an important topic, and I think your timing is really good, because I'm going to unpack this and just take a little bit of time. So hopefully this will really sort of land home for our audience. So obviously, without safe and effective vaccines, vaccine hesitancy is absolutely going to be an issue. If you remember our first discussion topic today on what it is. So, and when safe and effective vaccines are available, how can we ensure, right, that the public understands this? That's the key. So first, vaccines are tested for safety and effectiveness by vaccine makers, but also independent scientific committees. And then ultimately, through this whole process, what we know is from a safety perspective, any serious side effects are ultimately going to be rare because of the rigor as part of this whole process. So here's something really important, and I'm going to say it twice to make sure it's clear for everyone. So the standard for testing and monitoring vaccines is higher than it is for most other medicines. And this is because they're given to healthy people. So again, let me say that again. The standard for testing and monitoring vaccines is higher than it is for most other medicines because they're given to healthy people. So this means the level of acceptable risk is much lower than it might be, for example, say a cancer treatment, right? So vaccines go through a number of study phases before they're actually licensed, and there's a total of 4. So I'm going to go through each of the 4 very quickly. So first is phase 1. And this is where a small number of people, up to around 100 people, are given a vaccine to make sure there are no major safety concerns and to determine the best dose. Then we have phase 2. So this is a larger group, several hundred people. They're given the vaccine to check that it works consistently. So we've had it just up to 100 people. Now we've got a bigger group. We're going to still make sure it actually seems to work and to look for potential side effects, because the bigger the group you have, when you're studying the vaccines, the more you're going to see, does it really work? And is it really safe? So that's how we go step by step. So then there's the phase 3, right? So we've gone through phase 1, phase 2, phase 3. So phase 3 is yet a much larger group. So this is several thousand people. They're given the vaccine in order to gather even more information and ensure it continues to be safe and that it works. So it's a step-by-step process, continually making sure it works and it's safe. Now, once you finish that phase 3, the regulatory agencies, and for us in the US, that's the US Food and Drug Administration, the FDA, they then evaluate that data from those studies to determine if the vaccine should be licensed for approval or not. And not every vaccine actually makes it. So that's really important. Most vaccines that go through this whole process absolutely, unfortunately, fail. So it's very few that can make it through this rigorous process. That is super important to understand. Now, once you've gotten approval, you're still not done. So then there's what we call phase 4 studies. And this is where we continue to monitor for safety and effectiveness. So again, it's safe, it works in the wider population. And even after, as I said, the vaccine is licensed, there's still more work that happens here, right? So this is done by the CDC, by the FDA, in partnership with state and local health departments to continue to monitor the safety of these vaccines. And they also work with folks from universities, what we call academic institutions, and health plans, health insurance plans, to look at all the information they're gathering on people who've received the vaccine to see how well it's working and how safe it is. So this process it's quite intense. It is very involved, and it's really important to understand sort of how this process works. Now, when we think about COVID-19 vaccines, you know, as for all other vaccines, they too have undergone a very rigorous process of safety evaluation and effectiveness while they're in development, and since they've been licensed, authorized, and available to the population. Of course, it's been on an expedited timeline. So let's talk about that, because that's where people really get concerned. They understand this whole process, but then they say, but wait, COVID was faster, so I'm worried. So let's talk about this, right? So this expedited timeline was thanks to huge investment. And I'm not just talking about financial, I'm talking about people investment. So we had people who completely shifted their work. They stopped working on whatever they were doing and they completely focused on COVID-19. So this happened with researchers across the board. It happened with the FDA. It happened in places like Sanofi, where you just stopped everything you're doing because this pandemic was so important. This was your priority. So you had massive investment of people's time and energy and focus, as well as investment to actually focus on this and move things faster, because the public health emergency obviously was tremendous. So again, I can't overestimate or emphasize this enough. This expedited timeline was because of massive investment. Without that, we would still be looking for a solution to this pandemic. So in addition to the massive investment, there's also capacity building that had to be done as well. So we'll be ready and have vaccines available to us as quickly as possible. And the FDA was critical. So this investment of people was huge, but they also did the reviews of the data in a way that was much more intense, where they had rolling reviews of the data. So they didn't waste time in the review process to move this much more quickly and with unprecedented speed. We all know that this was fast, and I can tell you there were no corners that were cut. So, and even so, people say, well, there's still side effects that happen with this vaccine. That's the nature of all vaccines, right? So with all vaccines, mild side effects are to be expected. Your arm may be sore, maybe a little bit red or warm to the touch. Some people might have a fever or a headache, but these are actually signs that the vaccine is doing its job. It's a sign that it's actually working. And typically these mild side effects, they go away after a day or two. And I'll close by saying this. So I personally have tremendous confidence in the vaccine. Like everyone, you want to see how the data evolves. We've been through this already, right? We've had the vaccines for a long time. I've been vaccinated. I've been boosted. I think it's really important for people to understand how vaccines are licensed, and specifically the example of COVID-19 vaccines. And this is really a safe and effective vaccine that I support, and I personally have received and recommend that others do so as well.
Thank you, Dr. Muhammad, for that detailed explanation. So I think that's critically important for folks to understand that. Dr. Silvera, one of the things that you had talked about in your conversation, and it dovetails nicely to what Dr. Muhammad said, was and my words here, quote, I think you quoted, said the newer COVID vaccine and vaccines and such. Can you just take a minute to really talk about how it's really a building block upon other science that we've already had that got us to this point as far as the use of the COVID vaccine?
Well, in science, we are always standing on the shoulders of the giants that came before us. So this was none of the technology, whether you're looking at J&J, the mRNA vaccines, Novavax, it was just approved as well, are completely brand new. So they were built on technology that has been studied for decades and sometimes longer. And I want to sort of piggyback on what Dr. Muhammad said about the process. Scientists are skeptics, right? We go in looking at research and questioning it. We look at the methodology, we look at the results. I train my students and say, well, look at the results. Does that reflect what the methods? Was that answering the question they originally asked? Because you have to be skeptical. But there's a difference between being skeptical and being conspiracies, right? And looking for the conspiracy theory, right? Occam's razor, sometimes the simplest answer is the correct one. And so recognizing that when the FDA went through this panel, it was not simply the pharmaceutical company saying what happened, right? Or the people who work directly at the FDA. There's an external panel of scientists as well that were the first line of review, right? And so this went through multiple, and having listened to the FDA, those open meetings, they have open calls so people can call in and ask their questions. They're given time, and they're not voting in lockstep with one another. There are people who are questioning the data and pushing back, and they're looking at international data, other research studies that have come out, looking at comparisons. And so, when I say that you have to look at the process, part of this is also really, I think, reaching back to how we train the population or educate the population about the scientific method, and really understanding the iterative nature and how we in the field and people who are doing the work evaluate the research and look at that, risk benefit ratio, right? And so, when the people say, oh, but there has been this side effect, or I know somebody who had, that's not discounting the experience of those individuals at all. It's looking at, on balance, right, overall, is there a net benefit, right? And looking at the risk associated with COVID and COVID outcomes, and versus what are the potential risks, right? And are they long-term or short-term? And do we have the ability to address those risks in a way that reduces them further? And so when we talk about the risks associated with the vaccine, we also have to talk about the risks associated with COVID, right? And recognizing, I think now more than ever, that we are not talking simply about an illness that has an acute effect where you're sick for a period of time and then you get better, but we're talking about 20% of people who are experiencing cognitive dysfunction for months and months after they have COVID, and the impact of long COVID. And that is not just on young people, on older people. This is affecting young people as well. And so when we're talking about understanding the vaccine, we have to look at it in the context of the disease as well.
Ladies, I could spend all day listening to y'all talk about this, but some of our audience members have authored some really good questions. So I'd like to take a few of those, and I will ask you guys to really chime in on them. And Dr. Hudson, if it's okay, we'll start this first question for you. And the question comes from the crowd here. It says, often the underrepresented communities will receive programs such as this one to help with various initiatives to help them, which is great. But often those living with disabilities are not included in the messaging. For example, they may have a physician, but mobility concerns will prevent them from receiving medical care, or it may take so long they just disengage. How do we support that community? Because broad programming isn't reaching them. Dr. Hudson.
So that's a fantastic question and a great way to jump off to who's included in clinical trials and who's not included in clinical trials more broadly. So I will say that in terms of the work that we're doing, both here at Rutgers, but then even nationally, our organization is part of a consortium of schools across the country that are really focused on how do we better train our researchers to make sure that all of the voices are at the table as we're actually going through these processes of going from phase 1 to phase 4 studies. So one of the things that we've been doing is actually working with community groups, working with community organizations, faith-based groups to create what we're calling citizen scientists. So we actually have community action boards now as part of our studies that we're now putting forward, where we actually bring the community in as part of our research team, and we kick the tires or ask questions about, here, this is what our scientific rationale is. Now, as an everyday person living with whatever the disease is that may be a focus at that point, what is your understanding? And more importantly, is the science relevant to you? And if the answers are no, it's not relevant, then we need to go back and we need to actually rethink what we're doing and think about how we actually move it forward so that it answers both a scientific question of interest, but then also a relevant practice question. Is it going to be focused? So that's one of the things that we've been doing. And I will say, even in the original sort of framing of the question, in terms of looking at communities and disabilities and the issues around COVID-19, we know that people who have multimorbidity, meaning that they have more than one condition or other conditions that are just as important and may actually eclipse in some ways the COVID-19, that they tend to have worse outcomes if they are not vaccinated than they would have had if they were vaccinated. And so even if we are I know that there are a lot of concerns about the unknown, but we know from our empirical evidence that the outcomes are such that being unvaccinated in some ways is actually worse than not being vaccinated at all. So just to go back and sort of, to also add on to what Dr. Silvera said so eloquently, really important that we get the message out that the vaccines are safe, they are efficacious, that people in our communities need to be looking at those as viable and not as concerning. So I'll stop there.
Right. So, Dr. Hudson, I thank you for that, because I think you articulated something that I think many of us feel here, but there's still skepticism, right? So there's still people who are skeptical, and one of the comments that we had is that we should be skeptical. Why has natural immunity not been acknowledged or recognized? If we have spike protein antibodies present from previous infections, why would we need a COVID vaccine? And I will ask Ms. Foster, just for a second, if you have a comment on that, and then I'd love each of you to spend a little bit around that very particular point about natural immunity and where it plays at with respect to the vaccine. So, Ms. Foster, you start us off around the conversation around natural immunity.
Sure. So based on our panelists here, we do look at our research and our data. We look at hospitalizations every day, and the majority are those unvaccinated, just like what Dr. Hudson says, those with comorbidities. The natural immunity, unfortunately, we don't have data on who's naturally immune versus not, but just looking at the raw data of hospitalizations is what we need to pivot on. So I'll turn it over to my colleagues who are more equipped on that.
That's a fine answer. Dr. Muhammad, can you give us a sense around natural immunity and whether the skepticism is real or not, or around that, and maybe get some color around what that actually means, having natural immunity?
Right, and I think it's a question that probably all of us, if it didn't come into our mind, we've had people in our circles raise this issue, right? So if we think about the beginning of the pandemic, and there were countries, right, trying to struggle with the decision. What are we going to do? I believe perhaps maybe the UK was one where are we going to take the approach of herd immunity, or are we going to lock down our communities? And what we saw with some of those countries who sort of almost had the natural immunity approach, which is sort of herd immunity. What do I mean by that? That means allow the disease to go through the population, and eventually the population will build up their own immunity as a group. So that's what we call herd immunity. And eventually the disease should just sort of die out because everyone's immune. And we know that there's those countries who had that as an idea. They saw the disease just really go through their populations and impact people at such a high level. And it was scary. And some of those countries, they turned around and decided, no, we actually do want to lock down, and let's work hard to try to find a vaccine to help solve this problem. Because you're waiting for each individual in the population to hopefully develop immunity to protect them and not actually harm them and cause death, disability. We heard a bit about COVID is not just, a mild illness. You can have these long-term impacts. So you have the mild illness, you have the long-term impacts, you can have hospitalizations, you can have deaths. And if you only rely on natural immunity with this infection, we know that people will be lost that don't need to be lost, right? And the other thing I'll bring to this, and I'll stop so my other esteemed panelists can comment, is if you look at some of the data from the CDC, they have shown that people, even if you've had a natural infection, and then those who then get the vaccine and then who don't, the people who then get a vaccine after natural infection, they have better outcomes. They have better results, actually. So we know that the vaccine is actually providing something that isn't necessarily going to come just from naturally being infected. So I'll stop there because I'm sure my fellow panelists have some other comments around this as well.
Dr. Silvera, your thoughts on that?
So actually, Dr. Muhammad, you covered it, because I was going to bring up the CDC data on individuals who were previously infected and then the risk of reinfection. And there is actually quite a bit of data, growing data now, to show that for people who have had previous infections, the best way to prevent a subsequent reinfection is to get vaccinated. And again, fully vaccinated and boosted even more so. Again, and what we don't know, I think, long-term is what is the impact when people talk about the long-term impact of vaccines? What is the long-term impact on really multiple organ systems of having COVID multiple times? So this is a respiratory illness, but it's impacting cardiovascular system, your gastrointestinal system, your cerebrovascular system. And so we need to think about what are we going to see in terms of long-term disability related to people who have been infected multiple times. And so right now, as it stands, the data indicate that the vaccine is protective for those more severe outcomes.
Dr. Hudson, I'll allow you an opportunity to opine on that as well around the natural immunity conversation.
Sure. I think the only thing that hasn't been mentioned, and I think all of those answers have been super comprehensive. The only other thing that I would add is that we also know we're dealing with variants. And so just because you had the first batch of COVID doesn't mean that you're necessarily protected by Omicron or anything that came afterwards. And so yet another really compelling reason for us to make sure that we're getting vaccines, because the vaccines are actually being reformulated. And so it's almost like the flu shot. They always have to reformulate that every year based on which flu variant we're actually dealing with. And so we're going to have the similar issues with COVID as well.
So let me ask this question, and Ms. Foster, I'll start with you, but I will definitely want to hear from Dr. Muhammad, because it's a question that came up, and it's about why I think we do have vaccine hesitancy. And I think you ladies, you touched on it early on. The question was, why should we blindly trust the pharmaceutical industry when they've made serious mistakes in the past, and we know that no drug, medicine, or procedure will be right for everyone? Reports of severe adverse vaccine reactions are being completely discounted, was the question and comment from the individual. And I asked this in this context: when you're going out and talking, and I'll use the African-American community because I've had this conversation with so many. I have had folks reference back to the Tuskegee experiments as to reasons why I shouldn't be, as an African-American who is fully vaccinated and boosted, promoting everyone else getting vaccinated and boosted. So how are you engaged? How do you engage that conversation, right, around the issue of trust of the industry as you're having the conversations? So Ms. Foster, we'll start with you, but Dr. Muhammad, I know because you work in this space on a daily basis with Sanofi, I really want to hear your conversation point around it as well. So Ms. Foster, we'll start with you.
Sure. So I know Dr. Navarro Silva touched on this too, about like, how do we translate that science to something that's consumable for any resident? And that's what we try to do. We're looking at death data. We're looking at, who's the most impacted by the COVID. And a lot of it is our people of color. Yes, they might not be at the hospitals at this high level like it was 2 years ago, but it is a lot of our people of color, and we're seeing that left and right. When we do have these conversations, we're very honest. We do say, yes, this is not a perfect world where you're going to get the perfect of everything. This is public health. Public health is to ensure all residents have that access to the vaccine, and that's our job. Once you have that access, we want to ensure that we are trusting this product because it has saved millions of lives across the nation, in New Jersey as well. I mean, because of the vaccine, we have, saved moms. Hispanic men have been wiped out because of COVID, and we are saving these individuals and their family members. So we do have that personal touch of what if. What if you do get COVID and something bad could happen if you're not vaccinated? Right now in New Jersey, we're about 80% of fully vaccinated. Only 93% have at least one vaccine. For the boosters, it's at 58%. We're very low on boosters right now. And that's something that we are talking to many of our residents. But again, it comes from that trusted messenger, those who understand and who feel very comfortable with that community member.
Dr. Muhammad, if you can, the broad conversation, picking up where Ms. Foster left us off at, around the trust of the industry, and recognizing that there are some, and we know that there are some who've had adverse vaccine reactions, and regardless if it's this vaccine or others, it occurs. How do we work through that trust issue?
Yeah, absolutely. It's sort of, I would say the elephant in the room when we think about, populations who look like us. There is this question of trust, and we touched on it a little bit when we think about the provider that you can see and go to every day. But also there's some issues of trust, when we go up, I'll say sort of the totem pole, for lack of a better word. So trust sometimes in public health, you brought up the Tuskegee experiment, right? And then trust just generally of the vaccine industry, the pharmaceutical industry, right? So I can understand that. But I think the way, for me, when I think about the vaccine industry and what we do, like our charge is to bring public health solutions. So it may sound strange to people when I say this, but for me, I still work in public health. Why do I say that? Because here we're trying to develop the tools that doctors, nurses, pharmacists use so they can help keep people healthy, help prevent them from getting sick, right? So when we think about the solutions we're bringing, this was touched on by one of my fellow panelists around benefit risk, and that's what we have to do. We have to look at, we want to bring the solution, let's say it's a vaccine that's going to help reduce and control a infectious disease that's causing what we call morbidity or mortality. Morbidity means you're getting sick, you're going to the hospital, you may have disability after you recover. And then we all know death, right? Mortality. So we want to have a tool that brings benefit, reduces those things. But we know everything has a risk. Even getting in a plane has a risk, right? You know, this plane could unfortunately crash, but you look at the benefit risk of that. So with vaccines or anything, it's the same. So you want to reduce morbidity and mortality, and you want any risk to be extremely low. And as an industry and as a public health sort of community that's beyond, you know, vaccine manufacturers, that's what we do. Are we reducing the risk of this disease? Are we making benefit? And at the same time, any side effects, they should be mild, and anything serious should be rare. So I talked about this a few moments ago, where the typical side effects from a vaccine are those that tell you it's working. Your arm is going to be sore. We've almost everyone, if not everyone, has had that. You've got a sore arm, maybe a little bit red, and maybe warm to the touch. Those are the things that we're expecting to see, not something serious and rare. Now, I'll touch on two as well around sort of mistakes that have been made. And, you know, that's why we have that process that I described around the phase 1, 2, 3, 4 trials. The idea is that you want to identify any issues with what you're studying, whether it's medicine or vaccine, as quickly as possible. And that's why there's this process that happens, right, that we go through to see, are there any concerns that are evolving? And we take those steps in order to identify those errors. And again, remember, I mentioned that most vaccines that are studied, unfortunately, they fail. And they should, because that process is supposed to help us identify, no, the science was wrong here. And we move forward with a product, with a vaccine or a medicine that we then take to the external panel of the FDA, as one of the panelists mentioned. And then the FDA then looks at that data and says, yes, we believe you have benefit and any risk is very minimal, where most of the people are just going to have, for example, the vaccine, a sore arm, you know, warm, maybe a fever, headache for just a couple of days. So I think what we really need to take away from this is, you know, as a scientific community, we are looking for solutions that bring benefit and have absolutely minimal risk, so that we're actually helping, you know, communities move forward. And I'll stop by saying, it's, for me, I really always remember vaccines are only second to clean water as we look at the benefits to health over, you know, the last, you know, couple hundred years. And so vaccines are here to stay because they have been so successful, but we definitely have a responsibility as scientists, as a public health community, to make sure that as we go through the scientific process, that we're looking for that benefit and we're looking to minimize any risk.
Gotcha. Dr. Severi, did you want to chime in on this one?
Yeah, I was going to jump in to say that I think part of the reasons why that FDA external panel meeting is open to the public, now you have to look for it, and it's a very long day of listening, and some of it can get boring. But part of that is to have that transparency, to see the people present the data. They present the data on the risks as well as the benefits. There is an open discussion about that risk-benefit ratio before they are approved. And I think that that is in response to things like Tuskegee and to mistakes that have been made, and recognizing that there are human subjects review panels to make sure that people are being treated ethically in research, so that we don't go back to those problems that that we've had in the past, and that it's important to learn from the mistakes and then be transparent. I think what often happens though is, you know, who's going to sit around and watch those all day? And so we often get, and this goes back to that misinformation, disinformation piece, people who interpret those meetings and give you their take, right? And recognizing, you know, where are you getting your sources of information and what biases might be transmitted in that communication is also very important. So, you know, to go back to what Dr. Hudson said, right? Go back to the original source when it's available. And those are actually all there. They were on YouTube. They were on the FDA page. You can go back and watch them now, you know, if you have nothing else to do on a Saturday night.
That's some Saturday night then, because that's a lot. Those are some long pieces there.
I have a very exciting life, I tell you.
Dr. Hudson, just and we want to just grab a couple more, and then I want to make sure I leave time for my colleague, Assemblywoman McKnight, to lend some closing comments. But Dr. Hudson, there was a question here that I think is very interesting, and I'd love your take on it. And it's the question around the boosters. And the question was, what is the point of several boosters, right? Are we constantly going to go through a series of mild side effects? And this is quoted, mild side effects of upgraded boosters, upgraded doses, excuse me, each time a new variant comes along. So why the booster? Why continue to do it? And I think someone, I apologize which one of the panelists said it, referenced just like a flu shot, right? And the flu shot is different each year when you get it. So take a second on the booster conversation, please.
Sure. So I will start by saying that we are collecting data to answer that question as researchers, but we don't have definitive answers. I will say now on my own behalf, as a person who is actually enrolled in a study where they're checking things, I actually am enrolled in a healthcare cohort where they check my levels of immune response every time I have a booster. So I've now done this. I've been double vaccinated, double boosted. And each time I've gone in about a week afterwards, I've had a super like huge response to it. And about 6 months later, right before my next booster, then they take my blood, they check it again. And I'm basically where I was before I even started the process. So I can tell you for myself, being part of this cohort study where they're checking our levels over time, they're trying to contribute to the science. And what I'm looking at for my own data as an N of 1 point, I can see that there is a significant drop off at the end right before I get my booster. So going back to the question, which is, could this be a system of having to do this? It's quite possible that that may be where we're going, but we really don't have all of the data. And so that's why it's really important for all of us, I think, to be involved in studies to the degree that we can, because one of the reasons why I actually did that study was I wanted to make sure that they had a diverse enough representation of individuals to be able to say that for others who are going to come after me, that the data is actually going to work for folks who look like us. So for me individually, I am okay with the risk that I will have mild flu-like symptoms every 6 months to not have to worry about my comorbidities possibly becoming an issue and then not necessarily making it from COVID or from having long COVID. So that's my own personal choice on this based on the best data that I could get. But we're in the process now of doing that science and doing that research, and that's sort of where we are. So I think if people say they have a definitive answer to that, then you should be skeptical, as Dr. Silvera said, because we are working through it, but it's really important to make sure that that scientific process happens and that we go through and go forward with it.
Thank you, Dr. Hudson. Ms. Forster, there was a question here. I want to know if you can opine on it just a little deeper. The question was why, and I think it was referencing something you said, and I'm just reading the question here because I don't necessarily remember you saying exactly like this, so that could be on me. But the question was, why did COVID wipe out Hispanic men? Was it due to their health genetics or lack of awareness towards COVID-19? Can you just provide a little bit more color around that, please?
Sure. So when we started to see a lot of our young men between the ages of 18 to 54, Hispanic men dying at the hospitals, we started to see a trend. A lot of them were essential workers. They were not allowed to stay home and rest and get some medical assistance. A lot of them were, of course, had to work for their families. And we didn't know what COVID was happening. We didn't know what was going on until we got to see these more demographic reports. And that's why we realized, and then we started to see it with our young Black men too. And then we started to see it with our young Black our female moms. So there was this trend happening very, very quickly. And here at the Department of Health, we had to keep on reacting to save lives. And that's why we had to build many, many field medical stations and worked with the hospitals, give them more resources for ventilators. And again, it just became a very reactive mode because these generations of people were dying in the hospitals.
Thank you. Thank you for that clarification. ladies, this is my final question, because I honestly could keep going on and on, and the panel and the audience are asking great questions, and this is a really good dialogue wherever you fall at on the vaccine spectrum. I think it's important. Dr. Severi, thank you for adding color to the chat with information for folks to find their own sources, and others in the chat who put other information up so folks can whether not regurgitate anything, do their own critical thinking to make their own decisions. I think that is important here. My last question, and I'll go around the table for everyone to sort of answer this, and it is a great point. The question is, how would you engage conversations around vaccine hesitancy due to observing reinfection in others who have been vaccinated or boosted? Now, I'd ask you just to give as quickly as you can, because I want to leave some time for Assemblywoman Sumter, who's going to close for us today. So we'll go right around. Dr. Muhammad, we'll start with you, and because you're at the top of my Hollywood squares here, and we'll make our way around. So Dr. Muhammad, how do we engage the conversation around vaccine hesitancy when we are seeing reinfection in those who have been vaccinated and boosted?
Right. Yeah, thank you. And, obviously it was brought up that people are they want to move on from the pandemic, but we know that it's probably going to be here for a while. These new variants keep coming. We know that immunity sort of drops off after a few months. And I think it's important to communicate, as closely as we can with the groups who are having hesitancy to understand what their concerns are and to bring the science to them to help them understand what's going on. But really important is, a lot of times, and this was said earlier, people understand and they know the information, they just don't have trust around the messenger or how it's being shared, and getting the access to that information that's trusted, and then access to the actual vaccine. So I think we need to have the right messages, and we need to understand who can we speak to within our communities that actually can help us deliver the scientific messages and give people what they need exactly when they need it. That could be faith-based organizations, that could be other types of community-based organizations, but I think those are the ways that we're going to make progress as we try to get out of this pandemic.
Thank you. Dr. Hudson.
I couldn't have said that more eloquently, so I'm going to just let it rest with Dr. Muhammad. She did a great job.
Thank you. Dr. Severi, any comments you'd like to add to that?
So what I would say is I think people are expecting vaccines to be 100% effective 100% of the time, and nothing is. Seatbelts aren't, but we still wear them. And neither are parachutes, but I wouldn't recommend jumping out of a plane without one. And so just because something isn't 100%, if it reduces your risk, we're talking about risk reduction and harm reduction, that is where I think we need to focus our message. And I will share, I am boosted, vaccinated and boosted. I still wear a mask when I'm in an indoor space with people with whom I do not live, because this is about layering prevention to reduce the risk to myself, as well as to members of my family who are even more susceptible than I am.
Thank you. Ms. Forrester, comments around that question?
No, I love what Dr. Silvera said about the parachute. I'm going to use that because I think that's the message, is that risk reduction, and we don't want to have everybody be on a parachute and jump off a cliff. So thank you for that, because I agree. It's all about that health literacy. How do we make it simple and digestible?
Ladies, first of all, thank you so much for your time, your talents, and the work that you're doing to really help us all be better educated around vaccine hesitancy. It is critically important. This conversation is timely and is purposeful and is necessary. It is my honor to have our chairwoman of the New Jersey Legislative Black Caucus, my friend and colleague for many, many years, Assemblywoman Shavonda Sumter, who's going to close out our panel today.
Thank you, Senator. You did a wonderful job. Had no doubt that you would be spot on with being a moderator for this panel. To my esteemed ladies in healthcare, trusted sources. I can't say enough. I felt a little wonky because I was getting excited as you all spoke truth to power. While we're all fatigued with talking about vaccinations, talking about COVID, is still a part of our daily lives. And what we try to do as a Legislative Black Caucus is partner with our pharmaceutical industry as well as the foundation to bring trusted sources to the community to deliver these messages and allow a safe space for questions to be asked that people are curious about. The takeaways from this session include making sure you have a trusted source and not rely on a snippet you may have heard or one instance where someone may report something off. 2, making sure you have community healthcare partners that you're working with. And we have some great resources right here in the state of New Jersey, including the Department of Health, Rutgers University, and the list goes on in the state of New Jersey. We are fortunate in that sense. 3, as elected officials, as the Black Caucus, and you all know this, our panelists, we worked hard during the pandemic to make sure we pushed information out where people could get valid information, where they could find COVID tests, where they could get vaccinated. We were that resource that was trusted for our communities, houses of worship, community centers, senior services, the list goes on. And we also heard from countless people who were essential workers, small business owners who needed assistance with resource and securing protective equipment, and the list goes on. It's our hope that we'll continue to have these sessions. I can't thank each of you enough for taking your time to share critical information that's up to date, current, relevant, to demystify vaccines and where we're going in the future. As leaders, it's important that we continue to bring these messages to our constituencies. And thank you to all the guests who have tuned in and stayed with us through this program. We will repost it as well on the foundation website. You will see poll surveys coming up in the chat because we like to hear from you to know what time works, how you heard about this program, so we can continue to push critical health information out to our communities who were most gravely impacted by this pandemic. So thank you, thank you, thank you.